I think as we see the data mature, I think the recent updates that we're seeing, the ongoing updates, are what's really important. Being able to see the long-term follow-up and the duration of response is critically important. So as we see the continued follow-up for all of the immunotherapy and immunotherapy combination studies, we're seeing what the long-term benefits are of helping patients and caregivers get through the upfront toxicities and side effects. And for those that have had treatment-related side effects that require us to discontinue therapy, it has been really amazing to me to see that these patients may be able to maintain the response in spite of being off therapy. So I think what's being referred to as treatment-free survival is a really new important concept that we need to look at about how to individualize treatment, treat to a goal, but then maybe take a treatment break, a drug holiday, or monitor patients and then reinitiate treatment when it's clinically appropriate or clinically relevant. And that, I think, is one of the newest scenarios that we're seeing in clinical practice. Megan, what do you think?
I think you did a wonderful job explaining that, Laura. So when we're talking about the advancements coming out right now, you are right in that a lot of us are waiting on the real world data to mature and collect that data so that we can all feel even more secure. And I'm hopefully stay very, very optimistic on these first line or even any of these new treatment combinations that are coming out right now, because we've all seen the data. Now we're waiting for the real world data to come out. And that's really what I have to add on that segment, because we all see the clinical trial data come out, but we know how that can mature and when we get it out to the general population. Virginia, how about you? Any additional thoughts on that?
Just to piggyback on what you both said, because you both covered that extremely well. Obviously, in this January, Cabo-Nivo was FDA approved, and that's been a great combination that we've used a fair amount in our practice. Also, just earlier last month, tivozanib was FDA approved for a use in third or later line therapy. So it's great that we have continued new FDA approvals. And there are also things that are still in clinical trials that, again, as Laura said, until we have the data, we can't really predict what's going to happen. But there are some promising things, for adjuvant therapy. If we can have our stage 3 patients get adjuvant therapy and not progress to stage 4, that would be pivotal. And so hopefully some of the trials that are now ongoing will see some of those things show benefit and be safe, and we'll be able to move into a new area for our patients.
Yeah, and Virginia, to continue that conversation as far as the clinical trials, it was amazing to see what the story behind tivozanib was, because I sat with one of my physicians listening to the ODAC meeting, realizing that tivozanib was not going to get the approval or the recommendation from ODAC, so they had to go back to the drawing board. Right. People that participate in clinical trials or are asked to participate in clinical trials need to realize the contribution that they are making, and the nurses and the all the providers that are involved in clinical trials need to recognize the contributions that are being made not only today, but tomorrow and several years from now. As Megan said, she wasn't practicing when a lot of the drugs you and I were using early on, and struggled to have a second or a third option for patients. And now we have a significant number of them, and we're also using them, as you mentioned, in adjuvant and in neoadjuvant settings. So, for those that are new to clinical practice, stay tuned. The world is ever changing.
It's a great time to be in kidney cancer.